This is the time of year that if you're in a Medicare Advantage plan and you're looking to leave, now is the time that you can do that. And it's kind of complicated, but it's not that difficult. But the way they set it up to lock you in for a period of time really makes it more complicated than it should be. But if you're looking to leave your Medicare Advantage plan, there's a number of reasons that you might want to leave. So if you've joined into Medicare and somebody sold you into a Medicare Advantage plan, because they can sound really good when they're being sold to you, and then you find out later that it's not exactly what you thought it was. So number one, maybe your doctors aren't in the network, or the hospitals that you use are not in the network, or even worse, your doctor is in the network, and then a couple months into the plan year, your doctor leaves the network, and you have to find a new doctor. It can happen absolutely with specialists as well, or even the hospital right down the street that you use may be in network, and then all of a sudden they have decided they're not going to contract with that Medicare Advantage plan going forward, and you no longer have access to that hospital, or if you did, it would be at a much higher out-of-network, out-of-pocket cost. So a lot of things can happen within a Medicare Advantage plan. Things change pretty frequently within these plans. So a lot of times people get in and then they're looking to get out. And to get out, there are a couple things you need to understand. I just wanted to jump in for a quick second and invite you to join my private Facebook group, Talking Medicare, where you can get answers to just about any questions on Medicare and interactions with others that are also in Medicare. There are no agents, no sales whatsoever. It's absolutely free. Just visit talkingmedicaregroup.com. It'll take you right there. You can sign up for free. Easy to do. Enjoy the video. Now, when you're going to go back to original Medicare, again, there's a time period that you can do this. And right now, Medicare open enrollment runs from October 15th to December 7th. So during that period of time, you have to make the decision. You have to initiate cancellation of your Medicare Advantage plan, and it will go into effect on January 1st. So that's a very specific period of time. Now there's another period of time right after it called the Medicare Advantage disenrollment period. And the reason I believe they set this one up is for all the people that get sold into Medicare Advantage during open enrollment and then find out it's absolutely not what they wanted, and it gives them an opportunity to get out without being locked in for the entire year. So the Medicare Advantage disenrollment period runs from January 1st all the way through the end of March. And whenever you initiate the change, it will become effective the first of the next month. So you have two different periods, and why they don't just combine them and make them one period and just make it easy for everybody to do this, I don't know, but we gotta work within the rules that they lay out. So we have the original open enrollment period, which really is more for people changing Medicare Advantage plans. They want to get out of one and into another, or change their drug plan, get out of one, get into another. And again, it's kind of crazy. If you're on original Medicare with a supplement, you don't have any of this because there's no changes. Everything's exactly the way it was when you set it up. You can use any doctor, any hospital, anywhere in the country that accepts Medicare. The benefits are identical. The only things that change are the Medicare Part B deductible, generally goes up a little bit every year. But from an out-of-pocket standpoint, pretty similar. But providers are all the same. Nobody opts in and opts out from original Medicare. It's pretty steady, so much different than Medicare Advantage. So if you want to get out of your Medicare Advantage plan, first thing you need to understand, you can go back to Medicare A and B with no questions asked, but that's not always the best option because there's some out-of-pocket expenses there. Part A has a big deductible, Part B has a small deductible plus 20% coinsurance, which doesn't have a stop. So if we're going to be on original Medicare A and B, we're going to want a Medicare supplement plan that covers the things that A and B do not. So our out-of-pocket expenses are significantly lower. So Medicare Supplement Plan G or Medicare Supplement Plan N, if you watched any of my videos, you're pretty familiar with that now. And that's what we want to find. But in order to get that, in most states, you have to go through medical underwriting. In other words, the insurance carrier for that Medicare Supplement plan has to approve you. And it's not complicated, but you have to be in reasonably good health. You don't have to be in perfect health, but you have to be in reasonably good health. There's a list of medical questions that you need to answer no to. Have you been in the hospital in the last year with something significant? It's pretty much major stuff like cancer or COPD or rheumatoid arthritis, things of that nature, kind of like life insurance, would preclude you from getting a Medicare supplement plan. So what you want to do is get your application in. Doesn't lock you into anything, but we apply for a Plan G or a Plan N, with whichever insurance carrier is the best value in your zip code. Then we get the answer from them. Sometimes it's immediate, sometimes it's an automatic yes, sometimes it's an automatic no, but we need to get that answer from the supplement company before you look to cancel your Medicare Advantage plan. So we want to do this a little early. If you're going to do it during open enrollment, you don't want to wait all the way right up till December 7th if you come in on December 6th, because you'll never get the answer back whether you're approved or not. So visit my website, MedicareOnVideo.com, fill in your basic information. We'll email you the quote for the best supplement where you are, Plan G, Plan N, sometimes high deductible G, and it depends on what makes sense in your zip code. And then the application takes very little time. We'll email you the list of questions. You look at them. If you can answer them all no, then it makes it a lot easier, makes it a lot more sure that we're going to get approval. A lot of it's based on medications, so we need to know what medications you've been prescribed for the last 2 years. But other than that, there's no physicals, there's nothing personal. It's basically just being able to answer the questions. So we'd be happy to make sure that it all goes as good as it can. So just visit MedicareOnVideo.com. We'll take everything from there. We'll walk everybody right through it. And then hopefully we'll get the approval. And then that's when you make a decision, really. So if you decide for some reason you don't want it and you want to stay on your Advantage plan, that's okay. But we know what our choices are. So very important to get it done early. And then again, if we miss open enrollment period, we've got another disenrollment period at the beginning of the year that we can do things. Hope you found this helpful. Look forward to helping you. Have a fantastic day. Wait, don't go anywhere. There's a couple more videos right here that you'll find very helpful with your Medicare journey. So take just a minute, watch the videos. You can also subscribe to my channel by clicking this button, and that way you'll have access to all my videos for everything that you need for Medicare. Hope you find it helpful. Have a fantastic day.